Appendicitis is an gastrointestinal disease condition. Look at this picture, shows that appendicitis. Then ultrasound, normal and abnormal. Look at this. CT scan findings. And MRI. Look at these findings. Detail going on. Appendicitis is an inflammation of the vermiform appendix and is one of the most common causes of acute abdominal pain requiring emergency surgery. Early diagnosis and prompt treatment are essential to prevent complications such as perforation and peritonitis. This overview provides a detailed insight to the multifactored aspects of appendicitis, which is critical for healthcare providers, particularly in emergency, surgical, and nursing care settings. Etymology. The term appendicitis comes from the Latin word appendix, meaning something attached, combined with the Greek suffix itis, meaning inflammation. Therefore, appendicitis refers to the inflammation of the appendix. A definition. Appendicitis is defined as an inflammatory process of the appendix, typically initiated by luminal obstruction followed by bacterial overgrowth. The inflammation can progress rapidly and if untreated may result in perforation leading to peritonitis or abscess formation. One, acute appendicitis. The most common and rapid onset from characterized by sudden pain, inflammation and potential progression to perforation if untreated. 2. Chronic appendicitis, less common, presenting with intermittent abdominal pain due to persistent low grade inflammation or incomplete resolution of an acute episode. 3. Suppurative appendicitis involves the formation of pus within the lumen, indicating a significant bacterial infection. 4. Gangrenous appendicitis occur when the inflammatory appendix undergoes tissue death, necrosis, due to compromised blood flow. 5. Perforated appendicitis represents a complication where the inflamed appendix ruptures, releasing infectious material into the peritoneal cavity, potentially leading to widespread infection. Causes: 1. Luminal obstruction, commonly caused by a hardened stool, lymphoid hyperplasia, foreign bodies, or parasites. 2. Infection. Viral or bacterial infection can cause lymphoid tissue in the appendix to swell, leading to blockage. 3. Other factors. Conditions that alter normal gastrointestinal motility or immune responses may also contribute. Risk factors. 1. Age. Peak incidence is observed in adolescents and young adults, though it can occur at any age. 2. Family history. A genetic predisposition may play a role. 3. Diet. A diet low in fiber can lead to constipation and formation of fecalids. 4. Infections. Previous gastrointestinal infections may predispose individuals to inflammation. 5. Environmental and socioeconomic factors. Variations in hygiene and healthcare access must influence the incidence. Complications. 1. Perforation. Rupture of the appendix can lead to the spread of infection into the peritoneal cavity. 2. Abscess formation. Localized pockets of pus can form around the appendix. 5. Sepsis. A systemic inflammatory response that can be life threatening. 4. Adhesions. scar tissue formation in the abdominal cavity, which in rare cases may affect fertility or lead to bowel obstruction. Pathophysiology. The pathophysiology of appendicitis follows a step-by-step process typically involving the following stages. 1. Obstruction of the appendix lumen. The process usually begins with an obstruction of the lumen opening of the appendix. This can be caused by hardened stool, lymphoid hyperplasia, or foreign bodies. 2. Increased pressure. The obstruction prevents the normal drainage of mucus and fluid from the appendix, leading to increased pressure within the organ. 3. Bacterial overgrowth. The stagnant contents promote bacterial growth, causing the appendix to become infected. The most common bacteria involved are Escherichia coli and other enteric pathogens. For inflammation, the infection had increased pressure leading to inflammation of the appendix wall. This inflammation causes the appendix to become swollen, red, and sometimes gangrenous. 5. Compromised blood flow. As the inflammation progresses, it can compromise the blood flow to the appendix, causing ischemia, lack of oxygen, when can lead to tissue necrosis and further exacerbates the infection. 6. Perforation. If the condition is left untreated, the appendix may eventually perforate, rupture, releasing infectious material into the peritoneal cavity. This can lead to peritonitis, severe and potentially life-threatening infections of the abdominal lining. 7. Systemic response. In severe cases, the body's immune system responds to the infection, leading to fever, elevated white blood cell count, and potentially sepsis if the infection spreads. This process explains the progression of appendicitis, and it highlights why early diagnosis and treatment are crucial to prevent complications. Signs and symptoms. 1. Abdominal pain typically starts as diffuse or preumbilical pain that later localizes to the right lower quadrant. 2. Gastrointestinal symptoms. Nausea, vomiting, and anorexia are common. 3. Fever. A low grade fever may be present initially. High fever can indicate perforation. 4. Physical examination findings. Rebound, tenderness, guarding, and rigidity. Specific signs include rousing sign, pain in the right lower quadrant when the left lower quadrant is palpated. Soya's sign, pain on extension of the right thigh, suggesting retrocecal inflammation. Obturator sign, pain with internal rotation of the flexed right thigh, indicating pelvic involvement. 5. Laboratory findings, elevated white blood cell count, leukocytes is often noted. Diagnosis. Diagnosis of appendicitis is based on a combination of clinical evaluation, laboratory testing, and imaging studies. 1. Clinical evaluation, detailed history and physical examination. 2. Laboratory tests, complete blood count CBC showing leukocytosis, C reactive protein CRP may be elevated. 3. Imaging studies, A. Ultrasound, often used as the first imaging modality, especially in children and pregnant women. B. Computer tomography CT scan provides a more definitive diagnosis and helps access for complications. C. Magnetic resonance imaging MRI, occasionally used in specific populations, example pregnant patients when CT is contraindicated. 5. Diagnostic laparoscopy, in uncertain cases, minimally invasive surgical evaluation may be performed. Nursing diagnosis, based on the clinical presentation and potential complications. Common nursing diagnoses include 1. Acute pain related to inflammation and tissue injury in the right lower quadrant. To risk for infection related to invasive surgical procedures and potential for perforation. 3. Impaired physical mobility due to pain and discomfort leading to limited movement. 4. Risk for deficient fluid volume due to omitting decreased oral intake and potential fluid shifts. 5. Anxiety related to the uncertainty of diagnosis, the impending surgical intervention, and potential outcomes. Medical management. Medical management involves both preoperative and postoperative care on surgical intervention. The definitive treatment is an appendicectomy, which can be performed laparoscopically or via an open approach. Laparoscopic appendicectomy is preferred due to faster recovery and reduced postoperative pain. 2. Antibiotic therapy. Broad spectrum antibiotics are administered preoperatively and postoperatively to prevent or treat infection. 3. Supportive care. Intravenous fluid to maintain hydration, pain management using appropriate analgesics, monitoring vital signs and laboratory parameters. For management of complications, if perforation, abscess, or sepsis occurs, additional interventions such as drainage of an abscess or intensive care management may be required. Nursing management. Nurses play a pivotal role in the care of patients with appendicitis. 1. Preoperative care. Conduct a through assessment of the patient's vital signs, pain levels, and laboratory results. Provide patient education about the condition, diagnostic tests, and the planned surgical procedure. Prepare the patient for surgery, example, obtaining consent, ensuring nil per OS status, initiative, IV fluids, and administrates antibiotics as prescribed. 2. Postoperative care. Monitor for signs of infection, bleeding, or complications. Manage postoperative pain using prescribed analgesics. Encourage early mobilization and deep breathing exercises to prevent respiratory complications. Monitor incision sites and dressing for signs of infection. Educate the patient and family about wound care, activity restrictions, and Signs of complications. 3. Continuity of care. Coordinate with the healthcare team for follow-up appointments. Ensure that patients understand the importance of reporting any new or worsening symptoms. Treatment options. Treatment options for appendicitis include 1. Surgical appendicectomy, laparoscopic appendicectomy performed for its minimal invasiveness, shorter hospital stay, and quicker return to normal activities. Open appendicectomy employed in cases where laparoscopic surgery is contraindicated or in complicated appendicitis. Example: perforation, two, conservative non-surgical management in select case of uncomplicated appendicitis. A trial of antibiotic therapy may be considered. However, this approach requires careful patient selection and close monitoring for failure or recurrence. Psychosocial medicine. Addressing the psychosocial aspects is crucial for holistic care. 1. Emotional support and reassurance. Provide empathy. Actively listen to the patient's concerns and offer reassurance to alleviate anxiety related to surgery and the unknown aspects of recovery. To patient education, explain the diagnosis, treatment plan, and post-operative expectations in simple, understandable terms. Use visual aids or written materials if needed. 3. Family involvement. Encourage family participation in care, decision, and post-operative support, ensuring that the patient does not feel isolated during hospitalization. For stress management techniques, teach relaxation methods such as deep breathing exercises, guided imagery, or meditation to help manage anxiety. 5. Effective communication. Maintain open line of communication between the patient, family, and healthcare team. Encourage questions and provide clear, consistent updates about treatment, progresses, and recovery. Prevention. While appendicitis cannot be entirely prevented, certain strategies may help reduce the risk or aid in early detection. 1. Dietary considerations. A diet high in fiber can promote regular bowel movements and potentially decrease the risk of fecal formation. To promote treatment of infections, early management of gastrointestinal or systemic infections may prevent lymphoid hyperplasia that can lead to appendicitis obstruction. 3. Awareness and education. Educating the public about the early symptoms of appendicitis. Example, pain migrating to the right lower quadrant, nausea and fever can facilitate early medical evaluation. For regular medical checkups, early detection and timely intervention when symptoms first appear can prevent progression to complicated appendicitis. In conclusion, appendicitis is a common yet potentially life-threatening surgical emergency that demands prompt recognition and intervention. A clear understanding of its pathophysiology, clinical presentation, diagnostic modalities, and comprehensive management is essential for ensuring favorable outcomes. The combined effects of medical and nursing teams emphasizing not only physical treatment but also psychosocial support play a critical role in patient recovery. Through early diagnosis, effective treatment, and proactive patient education and support, complications can be minimized, ultimately improving the quality of care. Thank you. Have a nice day.